Hi, I'm Brittany Schrader, and I chose to do my project on hospital-acquired pressure injury prevention. So what are pressure injuries? They are injuries to the skin or underlying tissues because of pressure, moisture. They are often preventable and can be associated with increased morbidity and mortality. Every year, 2.5 million people experience hospital-acquired pressure injuries, and the hospitals themselves are not reimbursed for the treatment of these. In 2012, the general cost was $6 to $15 billion for healthcare-associated pressure injury treatment. So why is this important? Pressure injuries are obviously costly to the healthcare system, and they can lead to a lot of significant problems for patients. At LGH, a pressure injury prevention and skin protection bundle is often put into place for patients upon arrival to the unit. This can include every 2-hour turning, incontinence care, increased nutrition, and just regular skin interventions. Staff often disregard these bundles and interventions because they don't know the benefits that they hold. By creating this presentation, the hope is to educate staff on the benefits of the bundles and ultimately increase their compliance to decrease pressure injuries and their costs to the hospital and healthcare system. So the purpose of this presentation is to explore the effects of pressure ulcer prevention bundles on the incidence of hospital-acquired pressure injuries. The ultimate goal is to determine an effective bundle to implement and place into practice. By putting an effective bundle into practice, it's hoped to decrease the incidence of pressure injuries and the cost it's required to treat them. So the research question I created was, for adult patients at increased risk for pressure injury, does the use of a pressure ulcer prevention bundle reduce the future risk of the amount of pressure ulcers developed during hospitalization compared to traditional prevention interventions? So the research question can be broken down into the PICO model, the P being adult patients at increased risk for pressure injuries. The intervention put into place will be a pressure injury prevention bundle that is patient-specific. The comparison is traditional prevention interventions, just the things we're using now that we don't entirely understand why. And the outcome will be to decrease the amount of pressure ulcers developed during hospitalization. In order to find literature, I used the PA College's database. The primary database I used was CINAHL. When searching the articles, the primary search I used was pressure ulcers. And then in a secondary box, I used the term prevention. And then in the search options, I ensured to check full text, so they had full access to full articles. I also selected peer-reviewed because the rubric is looking for peer-reviewed articles. I also made sure to put an effective publish date so that the articles were no older than 5 years. So overall, I found 8 articles that had the potential to be used for the presentation. The primary articles chosen were primary research studies, so there were a lot to kind of sort through before you found the ones you needed. It was also important to look at the interventions of each study to make sure that they had a similar theme. The 5 articles that were selected followed the same general theme, all included the same general population, and had similar interventions placed. Initially, searching for articles was pretty frustrating. There's so many articles to look through. They are 10, 15 pages long, so looking through them can be time-consuming, frustrating. A lot of the frustration was because a lot of the articles that I was reading, I would get like halfway through and realized, this isn't a good article for the project. So there was a lot of wasted time. But as I kept going, I was able to find articles quicker and determine if they were appropriate earlier on. So the literature synthesis, looking at all the objectives, they were relatively similar. They were all concerned with reducing the incidence of pressure ulcers among hospitalized patients. The articles differed, however, with the interventions that were being put into place. So 2 of the articles stated that they were looking at the benefits of a turning and positioning system and the frequency to do these turns. 2 other articles were looking into the benefits of pressure ulcer prevention bundles and an admission risk assessment. While each study had slightly different interventions, they were all relatively similar with their findings. So 2 of the studies agree that turning and positioning systems are beneficial in patients. depending on the surface they're sleeping on and their overall risk with their nutrition, their moisture on their skin, their age, if they had bony prominences, the frequency may change. So those at lower risk can be turned more or less frequently, so 3 to 4 hours, and those at higher risk can be turned every 1 to 2 hours. It also made a point to say that it was important to select an appropriate surface for these patients. So those at higher risk were put on specialty mattresses that would distribute their weight while they slept, so turning wasn't as essential. Another article suggested that pressure ulcer prevention bundles did in fact work and decrease the incidence of pressure injuries, but it also said there was a high degree of uncertainty associated with the results and the study. It's pretty hard to see if an intervention in a bundle is actually working on a population because each patient is different. So they react to different things in different ways. So that led to all this uncertainty. Another study concluded that introducing pressure ulcer specialists that would implement these different strategies reduced pressure injuries occurrence by over 50%, which is a great number. When you have someone that specializes in a topic such as pressure ulcers, which is a huge issue in healthcare, can really help to motivate staff and allow them to understand why we do things. Understanding why leads to higher rates of actually following through and implementing those changes. Overall, the studies agreed that implementing pressure ulcer prevention strategies into practice decreases pressure injury rates, but the extent of this is undetermined. As I mentioned before, the population is very vast and different, so trying to narrow it down and determine if these interventions are specifically working is pretty difficult. So when it came to reviewing the literature, this again began with reading through the articles and highlighting important information from each individual study. Then I was able to take the interventions and objectives, compare them, and then group them based on similarities. Once they were grouped by this, the outcomes were added in. So they were further broken down. They were all similar, which was helpful, that pressure ulcer prevention interventions or bundles do not prove to have statistical benefits. Initially, it was pretty difficult to appraise and synthesize the articles because it's such a foreign concept. It's not something I'm familiar with, so it was difficult to get the hang of. And as mentioned before, anything with these articles has been super time-consuming. But with more practice, it became easier, and there was more benefit out of it. So, when looking at these studies and implementing them into practice, the current practice at LGH uses the pressure ulcer prevention interventions based on the results of the Braden scale. So on the screen here, you're going to see a Braden risk assessment scale. Each patient has these completed every shift at LGH. The numbers are then totaled up to get a total Braden score, which is then associated with their risk for pressure injury. At LGH, anything 18 or less is when we start intervening and putting pressure ulcer interventions into place. But that doesn't necessarily have to happen. If you have a patient that scores like a 20, but they're not moving around in the bed, you can still turn them. So this isn't 100% saying like this is what you have to do. This is just a guideline to go from. The current standard of care ultimately determines the interventions and applying them to the patients at risk. But based from the findings in the literature, there should not be a change to current practice. We are doing a great job using the risk assessment scale to determine interventions. So there's no need to change it. Studies don't say that it's less beneficial, that something's more beneficial. There is just not statistical data that supports the benefit. In LGH, like I mentioned, the Braden scale should still be used to determine individual risks and needs. It allows for patient-specific interventions, and it is the current practice at LGH. While there's no solid evidence that pressure ulcer prevention bundles are effective, it is still important to keep them in practice just because you want to keep your patients as safe as possible. Since there's no direct change to current nursing practice, there shouldn't be any issues related to cost or education. The only issue that comes to mind is poor staffing. That's become an issue at LGH. You're poorly staffed, it makes it difficult to keep up on your turns, to keep up on your incontinence care, to make sure all these interventions are in place. So that will be a big struggle. So to conclude, pressure injuries nearly impact 25 million people every year, even though they are almost 100% preventable. While LGH uses the Braden scale to determine interventions, literature has been unable to determine the effectiveness of this scale and these interventions. With the information determined from this project, there is not enough information to change current practice. Thanks for listening. I hope you enjoyed.